There's a new health initiative that's trying to flip the script to finally give sleep the attention it deserves. The whole goal is to move sleep out of that neglect column and put it right where it belongs, as a top public health priority.
And this isn't just talk. This push is coming from a really cool team-up between two health departments in Utah, the Southwest Utah Public Health Department and the Davis County Health Department. They're actually joining forces for National Sleep Awareness Month to launch this big sleep health initiative.
And you have to hear this quote from Dr. David Blodgett over at the Southwest Utah Public Health Department. He's basically saying, hey, even we in public health have been dropping the ball on this. We haven't treated sleep like the major health factor it is, and it's time to fix that. That's a big deal. It's a real official admission that the conversation has to change.
And here's why this is so urgent. Dr. Blodgett points out that about a third of the entire population, 1 in every 3 people, is probably dealing with a sleep deficiency. That is a huge number. We're talking millions of people who aren't getting the kind of rest their bodies and brains desperately need to function. It's not a small problem. It's a massive one. So why all the fuss? Well, Brian Hatch from the Davis County Health Department puts it just perfectly. He calls sleep a powerful catalyst. I love that. It's not just about feeling less tired. It's about turbocharging everything else: our physical strength, our mental focus, and our ability to bounce back from stress. It's the engine for everything.
Okay, so we get it, sleep is important. The big question is, what do we do about it? Let's get practical and open up the toolkit. This whole initiative isn't just about telling you sleep is good, it's about giving you simple, proven strategies you can literally start using tonight.
Now, the science behind these tools is based on something called cognitive behavioral therapy for insomnia, or CBTI. I know, it sounds a little intimidating, but the idea is actually super simple. It's just a set of well-researched practices that help us fix the 2 things that mess up our sleep the most: our habits and our thoughts.
Okay, tool number 1 is sleep hygiene. Think of it just like dental hygiene, simple daily habits for better sleep. First, get a consistent schedule. Going to bed and waking up around the same time, even on weekends, trains your body's internal clock. Second, create a wind-down routine. For 30 to 60 minutes before bed, do something relaxing. It tells your brain, hey, we're landing the plane now. Third, your bedroom needs to be a sleep cave, dark, cool, and quiet. And finally, watch out for those sleep killers like late afternoon caffeine or alcohol. They can hang around in your system for hours and wreck your sleep quality. All right, but good habits are only half the battle. So much of our sleep trouble happens right between our ears. That's where the second tool comes in. It's all about changing the way we think about sleep.
This is such a perfect example of what they call thought reframing. We've all been there, right? Staring at the ceiling, thinking, oh no, I'm not going to sleep. Tomorrow's going to be a total disaster. That thought creates stress, and stress makes it even harder to sleep. The trick is to swap that thought. Instead of panicking, you tell yourself, look, my body just needs to rest. It's not a performance. I'm just going to relax, and sleep will come when it comes. It takes the pressure off, and it is a total game changer.
So let's pull all this together. What this whole thing is really about is shifting our mindset. It's about seeing sleep not as something that just happens to us, but as an active, conscious choice we make for our health every single day.
So what are we aiming for? What's the goal? For most healthy adults, that sweet spot is somewhere between 7 to 9 hours a night. And that's not just some random number. That's what science shows our bodies and brains need to fully recharge and get ready for the day ahead.
But of course, it's not a one-size-fits-all thing. Our sleep needs change as we go through life. And it's super important to remember that infants, young kids, and especially teenagers need even more sleep. It's absolutely critical for their growth and development.
And I think this slide says it all. This is the main takeaway. You can have the cleanest diet in the world and the perfect workout plan, but if you're not sleeping, you're building your house on sand. Good sleep is the foundation that makes all your other healthy choices actually work.